South Carolina's behavioral health care system is in crisis. Too many patients have no place to go for the care they need. I'm standing in front of one of the state mental hospitals that served thousands of South Carolinians, but as you can see, it now stands empty. Over the past 20 years, the state has drastically reduced the number of psychiatric beds, even closing entire hospitals like this one. Initially, the goal was to provide more treatment options in local communities, but in recent years, these cuts have been purely budget-driven. Funding cuts and bed reductions have gone too far, making it nearly impossible for many people to find the treatment they or their loved ones need. Hello, I'm Thornton Kirby, president of the South Carolina Hospital Association. 1 out of every 4 people will develop a mental disorder at some stage in life. That makes mental illnesses more common than cancer, diabetes, or heart disease. And like those physical illnesses, mental illnesses can affect anyone, regardless of gender, race, education, or income.
Actually, I think the general public likes to be removed from 3 classes of people. And those 3 classes are prisoners, the homeless, and the mentally ill. And I think that because it is not a pleasant thing for them to see and become aware of. It's kind of like you're having to face a real problem in your community, and basically you want these people to be out of sight.
For nearly 2 decades, Buck Terry and his wife have dealt with the challenges and heartbreak of caring for their grown son. As a result of their personal experience, both are passionate advocates for the mentally ill. And Mr. Terry currently serves as a member of the South Carolina Mental Health Commission.
It's our job and the advocacy group's job to educate these members of the House and members of the Senate. I think if they really grasp the magnitude of the problem, I think they would fall into line and be a hero for the mentally ill. We have a problem with our community residential care facilities that, due to funding problems and regulatory problems, our CRCFs are closing at a fairly aggressive rate in our state. Well, what that does is it takes away that last phase for the client, the last phase where he's going to be, which would be that bed in the community residential care facility. Well, when those start disappearing, then our hospitals start backing up because they have nowhere to send their clients when they're ready to go. So they just have to hold them. And so our system will back up, which means that if our system is backed up and has no beds available, then what other system is going to back up? It's going to be the emergency rooms. They're going to back up.
Today in America, fewer than 55,000 persons are receiving treatment in psychiatric hospitals. Meanwhile, almost 10 times that number of mentally ill men and women are serving time in jails and prisons.
If American citizens were being held in a foreign country under the same conditions that they're being held in the jails in this country, there would be a great outcry for the American government to go in and rescue them.
Chief Mitch Lucas is administrator of the Charleston County Detention Center.
I typically describe the Charleston County Detention Center as the largest jail in the state and the largest mental health institution in the state.
Well, when I'm here by myself, I'll drink water, piece of papers on the wall, I put toothpaste on, I may write on the walls or anything like that.
For the most part, people who are mentally ill, when their time is up, or if they're released on bond, we give them their street clothes back and they go back out the door of the jail and they're right back into the community. That's not a good situation. And like I say, it's not unusual for us to have someone who is in and out of jail on a regular basis due to their mental illness, and they're not committing serious crimes, but they're committing nuisance crimes, and law enforcement has no place else to take them.
Well, I was arrested for trespassing outside the public library at 68 Calhoun Street, and I resisted arrest, and I was brought to jail. I get out of here, I'm free, so I could, go to West Ashley, kind of look around in the shopping mall, and then after that, do whatever I was, got the idea to do or led to do.
One of the things that happens when you're incarcerated is you lose government benefits. If you cut off all of these folks' resources, which we do because that's what the law says that we have to do, federal law, and then we cut them back out on the street, it's actually they're in considerably worse shape than they were before because whatever resources they had available before, they're probably not going to get back again until they end up so bad that they're in a psychiatric hospital. But these are mentally ill people, and if they were able to keep their condition under control, a lot of them would end up in jail to begin with. So I think this is a critical issue that's just not being addressed. That we talk about prison overcrowding and jail overcrowding. This is one of the simplest things that we can do to have a positive impact on the inmate population in South Carolina, is if we found a better way to deliver mental health services and provided more mental health facilities, then I think you would see a reduction in jail population and prison population in South Carolina.
The very good news is that mental disorders can be reliably diagnosed and successfully treated. In fact, recovery rates for mental illnesses surpass the rates for many other physical illnesses, including heart disease. The tragedy is that so few people receive the treatment they need, and much of the blame falls on our society. While we embrace and support cancer and heart patients, those struggling with mental illness are often stigmatized, abandoned, and even locked up. About 40% of Americans homeless suffer from serious and persistent mental illnesses.
Mental illness is a brain disease. People with mental illnesses have brain diseases. Schizophrenia is a disease no different than cancer is a disease or diabetes is a disease, and it needs to be treated as such.
Debbie Blalock is director of the Charleston-Dorchester Mental Health Center, one of 17 state-run centers providing community-based services to South Carolinians.
A lot of times folks with mental illness are seen as castaways and throwaways, and they're not. Vincent van Gogh was mentally ill. Abraham Lincoln was mentally ill. They all contributed massively to our world. We're often afraid of things we don't understand and don't know about. But if we provide education and people understand that it truly is an illness, it truly can be treated, that people really do get better and recover, I think they'll be less afraid of it and more inclined to treat it.
Take a few minutes out of your day and go check those people out. Go down to the mental health centers. Get permission, of course, because you have to get permission, but go down to the mental health centers and see what happens there. See the type of people that need help, that aren't getting the help that they need. See those type of people who honestly just cannot help themselves at this time. Just go down there and see it for yourself, and you'll understand the struggle.
Lloyd Hale is a bright and engaging young man who has dedicated his life to helping individuals who are struggling with mental illness and the hopelessness that it creates. Lloyd is very good at what he does, probably because he understands exactly what his clients are living. You see, Lloyd was diagnosed with schizophrenia about 10 years ago, but only received the help he needed after he was committed to the state hospital. Today, Lloyd is a certified peer support counselor with the Department of Mental Health.
I'm well. I gotta say I'm well. I'm at a point now where I can recognize my symptoms. The paranoia and all of that kind of stuff. I think a little bit of paranoia is always gonna be with me. I think the memories of the voices and things like that still stay with me. But I'm well. When I get to the hospital, it was a life-changing experience because I met this judge in there, a judge. I met a nurse, a professional boxer, and a lawyer I met in the state hospital as clients. I met a fellow that built cabinets for a living, and he had beautiful cabinetry work that he put in one of the hospitals or something. It was just a life-changing experience. I started believing that even though I do have the mental illness, I can speak like that one day. I can maybe be a lawyer if I choose that. That's what I want to be. You know what I'm saying? When I got into this whole idea of mental illness, I started thinking, can it be treated? Can it be treated? Okay, what do I need to do? Tell me what I need to do and I'll do it by the book. Just tell me exactly what I need to do. And I was committed to just doing that. And I try to tell other people the same thing. Don't cut any corners on yourself. You know, let's do this thing exactly how you're supposed to do it, and I can guarantee results.
Now more than ever, hospital emergency departments that were never equipped to handle mentally ill patients have become way stations for patients who are waiting for a psych bed.
This is a very unfortunate group of patients that have a very real medical problem, and they're often stigmatized in society as it is, but let alone put them in this kind of environment that is humiliating, that isn't optimal, and provide the care they need just makes it worse.
Dr. Gerard is Chief of Emergency Medicine in one of the busiest emergency rooms in the state.
Since we're now at a situation where we see a behavioral health patient and there is no place for them to go to get definitive care, and we have to hold them for days to weeks at a time, it has really disrupted and changed the way we operate in the emergency department. There is a higher readmission rate when we see people because we're really just trying to actually get them over the hump from being a danger to themselves or others, and really not looking at the long-term goal of stabilizing on the right medications, therapy, and getting them back integrated within society and have a normal functioning life. I don't think that there is a real great awareness of really how bad this is. I think that the mental health community and their family probably know, and people that come to the ED kind of wonder what is going on. We have people walking through the hallway in paper scrubs that are getting showers, and you know, they see people in what they might remember as being a waiting room and recliners with curtains pulled and security guards kind of scattered without the hospital, and I don't think that they were remember that or kind of wonder, you know, what is going on, that it isn't what you would expect to see when you come to an emergency department.
Our state's behavioral health system is a complex network of state agencies, mental health centers, courts, regional support services, and state and community hospitals. Each of these entities plays an important role in delivering treatment for individuals living with a mental illness. But despite the valiant efforts of healthcare providers and other advocates, the current system is dangerously fragmented and underfunded. The key to changing the system is to change society's attitudes. We must eliminate the stigma and misunderstanding among the general public and among policymakers that make it so easy to lock these people away and forget about them or leave them to fend for themselves on the streets of our cities. I urge you to talk about the problem and the need to fund more treatment options for the mentally ill. Tell your elected officials, as well as those running for election, about the urgent need to bring hope and recovery to the thousands of citizens who've been hidden away and forgotten.